How prevalent is this issue of magnesium deficiency in society today?
Well, part of the problem is most doctors don't even test for it, which is
Yeah.
you might be asking why. Like, why are we not actually testing for magnesium deficiency? So that's one problem. I mean, the short answer is on average, if you actually do like a good gold standard test for magnesium deficiency, whether you give an oral load and see how much comes out in the urine, or you do an IV load test, is the gold standard, half the population is going to be magnesium deficient based on the true, gold standard tests. And the reason, there's so many reasons. One, we're not eating as much as we used to.
Yeah.
We used to consume somewhere between 500 and 600 milligrams of magnesium 100 years ago. We're consuming half that now. And part of the reason why is because our nutrition, the foods that we eat, have been processed, but also the actual food that we eat that is natural, healthy food, we grow it differently. So it's 30 to 40% less in magnesium itself. So we have to eat 30 to 40% more food than 50 to 80 years ago just to get the same amount of magnesium. And then, of course, the book goes into like 60 different factors that contribute to magnesium deficiency, which most people are going to have at least one of those factors as an issue contributing to magnesium deficiency.
You talked about testing, and I read it's often overlooked. And you wrote only 70% of physicians request magnesium testing in certain patients where it probably should be done, but there's no one test to definitely diagnose magnesium deficiency. Talk about the current tests that are out there. You sort of mentioned that a little bit before, that one can take to see where their magnesium levels are.
Yeah. Well, I think the most available test is a blood test. And all you actually have to do is improve the typical quote unquote normal range. And if you put it into an optimal range, you can actually have a decent snapshot if you are deficient in magnesium or not. So magnesium is typically measured in the blood either as milligrams per deciliter or millimoles per liter. So typically your doctor won't diagnose you as deficient in magnesium unless your blood level is less than 1.7 milligrams per deciliter. If you simply just bump that up to 1.9 to 2, if you're less than that, that's a good indication that you may be deficient in magnesium. So we have a blood test that's not perfect, but if you improve just the level and you bump up how much, going from 1.7 to 1.9, let's say, that right there is going to really give you a good snapshot. The only thing that I like to tell people is that there are certain things that will actually keep magnesium normal or even high, which would be if you're on a thiazide diuretic for blood pressure, can actually increase magnesium levels. So blood won't be perfect there. Vigorous exercise can also increase magnesium levels acutely, and so can smoking. So it's not perfect, and that's why you typically want at least 2 tests. And some of the other tests would be a hair mineral analysis for magnesium, a muscle biopsy, which most people aren't going to do.
Yeah.
We talked about a little bit about the oral load where you absorb a third of the magnesium you eat. So if you're basically urinating less than a third of what you consumed, that means your body's holding on to it. And so that's a decent test where you look at 24-hour urine after you've either given an oral load or you've given an IV load of magnesium. Those are some tests. The best blood test is mononuclear blood cell magnesium, which is like a combination of lymphocytes and monocytes, because the immune cells, they actually match whole body status of magnesiums. But nobody orders this test. But that is, if I had to say, if there's one good blood test to get, that one is the best.
Yeah, because as we know, so much of the magnesium where it matters is intracellularly. It's inside the cell that matters. So we're doing a blood test, you're kind of seeing what's in the system, but not in the cells, unless you do that one where you're looking at specific cells within the blood and what they have within them, correct?
Correct. Yes. And basically, so you're right, 99% of all magnesium is found within the cell. It gets even more interesting when you take into account that there's bound magnesium, which is the unactive form or the inactive form, and ionized magnesium, which is the active form. So you can actually have good blood levels, but your ionized magnesium, which is the unbound, which is the active form, could actually be low. So things like high levels of free fatty acids in the blood, which happens when you're insulin resistant, they're negatively charged. They will bind positively charged magnesium ions and inactivate them. So if you're someone who's insulin resistant and you consume a lot of, let's say, heavy cream or a lot of fat in just one sitting, it'll release a lot of free fatty acids in the blood, bind the magnesium and inactivate it. And so that can actually induce like arrhythmias, et cetera, because all of a sudden you're acutely deficient in, circulating ionized free magnesium.
Yeah, when I speak to some integrated practitioners to try and get that picture of what's going on with magnesium levels, I hear the blood, testing, but as well, there are other ones. There's something called like oligo scan that could test within the kind of cellular and try to pick up, and it's kind of matching. But you're right, there's no one definitive way that you get it, and that's kind of, throwing people off.